Hello and welcome to Next Phase, where we examine the intersection of health and technology and talk about the future of our health system. I've got Dr. Ian Katz today. Hi, Ian.
Hi, how are you doing?
Yeah, really well, thanks. Ian's particularly interesting. Ian, as I go through your bio, I can see that you did your medical studenting in South Africa, but you've been here for 20 years. You're a serial entrepreneur. You started Sun Doctors over 20 years ago, and more recently, you've got an initiative in artificial intelligence. Particularly interested in that career journey, and then we might step into the COVID situation and how you see lasting change afterwards. Tell me a little bit about yourself to warm us up.
Okay, well, I'm actually a skin pathologist. So we set up skin clinics about 20 years ago, as you said, and then we started our own skin lab, and we've currently got the largest dedicated skin pathology laboratory in the country. We're seeing a lot of skin cancers, we're seeing a lot of melanomas, and over the years I've noticed that that the actual collection of the skin cancer data is very haphazard. Very few people are keeping images in a coherent fashion. People are keeping them on their phones and their files and their computers all over the place, and it's actually, unlike lots of the other sort of cancer-related fields, the skin cancer, which is actually the most common cancer, is actually very haphazard, and the data is kept in very different places. So we thought a couple of years ago we're going to start trying to keep the data in a more coherent fashion, so we can use the data to try and develop artificial intelligence methods for diagnosing skin cancer. Again, skin is the most visual of all the organs, and the lesions on the skin are so easy to photograph. And so we thought, let's try and start collecting the data, and so we can actually start producing and start generating some artificial intelligence algorithms. There's a lot of people around the world doing it, as you know. Google are doing it, and I'm sure lots of other people are doing it. So that's how we got started on this journey.
Yeah, medical data. Pathology has started on this digital journey earlier than some of the other disciplines, because you're dealing with high volumes of large file sizes. It's medically sensitive and really important information to turn around accurately in a timely fashion.
Yeah.
It feels like the rest of medicine now has to catch up a bit.
Well, pathology, there's different types of pathology, as you know, and some of the pathology data in terms of bloods and blood samples and microbiology have been keeping data for a long time. Radiology is like 20 years ahead of us in terms of artificial intelligence and using the images to generate algorithms. But pathology, because of the large file sizes, I mean, the files that we use are, for example, a slide like this. Just a slide like this would have a file size of almost 1 gigabyte. So the actual file size is actually really big compared to even radiology. So that's why, even though we may be a little bit ahead, we actually haven't done as much in digital pathology as we'd like.
Yeah, understood. So here we find ourselves in this crazy COVID time, and I can see that you're actually working in your office at the moment. So we're starting to trickle back to more normality around our work, but it's not going to be the same normal. It's going to be a new normal. Can you tell me a little bit about the disruption you might have experienced or seen firsthand, and then we can step into some of the things that you might consider to be lasting and enduring changes?
Sure, it's quite interesting. So, I mean, I can look at, I mean, here's my microscope here. I mean, I've got a microscope at home, so I can actually look at slides at home, but it's actually quite disruptive to go backwards and forwards with slides. And we do have a scanner in our lab, and we can scan the slides, but again, there's just a certain number of slides you can scan at that resolution to get, for 1 gigabyte a slide. But we've had immense difficulty with our broadband issues. Obviously, a lot of people in the area of using the internet, so broadband's been very slow, so we haven't been able to upload as many slides as we want. What's quite interesting in the clinics, though, is that patients have still wanted to have their skin checked. People still, and believe in quite rightly so, that if you have a skin cancer, it should be treated. So that's quite interesting. Actually, we found that the doctors are the ones who are actually scared to see the patients. The patients actually still want to come in and want to get treated. So we actually are sort of slowly getting busy again, and then we've got a couple of telemedicine apps that we've actually run out in the last couple of weeks, where people can take pictures of their spots, their moles, their skin cancers, and then essentially get a free consult of their spot by a doctor in the local area, and then if necessary get seen by the doctor. So that's actually got a bit of AI in it, but all the pictures get checked by a doctor as well, and then obviously one has to be very careful with that. But that's the beginning of the journey of us for using telemedicine to diagnose skin cancers.
Yeah, look, necessity is the mother of invention, isn't it? And it's interesting to hear, because you are essentially digitally enabled on the back end, that you're able to introduce some of those front end changes.
Sure.
Culturally, what do you think, how ready do you think patients are to start getting their skin lesions checked by telehealth technologies? And what do you think its role is going forward? Will it replace the face-to-face consultations?
So it's a bit of a balance, I think, because on the one hand, skin and dermatology is a very visual thing. So, I mean, you need to be able to see the lesion, you need to be able to see the skin. And the other problem is that the things that people tend to be scared of or concerned about on their skin tend to be benign things. And you usually, when you do a full skin check, you find the actual skin cancers in the high-risk populations. So in terms of patients, I think there is a demand for patients to have their lesions checked via apps. I think doctors have been forced to take up the telemedicine, which is really good. We couldn't get doctors to use telemedicine to do the stuff until there was a rebate, and now even if the rebate goes away, I reckon that a lot of our doctors will still be doing a lot of the stuff in telemedicine because it's actually beneficial. Patients don't have to come in; they can do things quickly. Even if there's no charge going forward, doctors and patients can see the benefits, and I think that's where it's been really good for us.
Yeah, that's interesting. I mean, there's clearly a lot of change going on at the moment, and your sense is that there's still a role for the clinic. But how about as we progress further with this AI journey? Already it starts to impact how much of it gets performed by humans versus how much of it can be achieved through artificial intelligence. What do you think the role of the doctor in the diagnostic process will be into the future?
Oh, I don't think there ever won't be a role for doctors in this diagnostic process. I think where we haven't got nearly close to with the AI is integrating all the different data that one gets for a patient. You know, even if you look at a spot, how much skin cancer has the patient had before? You know, the feel of the spot, how old the patient, the family history. There's so much data that one hasn't even begun to put into the algorithms. You know, are there any other spots on the person? Putting all the data together is still a long way away, and I think the doctor has to play a key role in that. So at the end of the day, I think there won't be much less work for a skin cancer doctor in the AI skin cancer world going forward.
Yeah. Can you tell me a little bit about that artificial intelligence that you're doing? Is it on the front end with the diagnostics of skin checks, or is it on the back end of processing specimens?
Yeah, so we're not doing too much on the front end. We are accumulating the data for that end. But what we've realized is that when a pathologist looks at a sample, he takes into account all the other data. You know, what it looks like clinically, even some molecular data, microRNA, epidemiological data on the patient, how many skin cancers, you know, if they've got red hair. So pathologists will take a lot of that data into account when they look at the slides. And our theory is that when we've got a big enough data set, we'll be able to scan the slides in, and then using the pre-lab data, we'll be able to have a really good idea of what the diagnosis is on the slide, even before the AI is performed on the slide. There's many companies around the world that are doing AI on pathology slides, but it's very difficult to make. There's a big difference between making a diagnosis of basal cell cancer on a slide, which is actually very easy, and then putting out all the other data that one needs on a pathology slide. You know, the margins, the depth, the subtyping, the you know, it's not, there's many algorithms that can diagnose this stuff, but there's a lot of other stuff that needs to be diagnosed, that needs to be put in a pathology report as well, and that's where pathologist is needed. So I think we're going to, in the next year or two, we're going to have decision support diagnoses. In other words, putting a report out in front of a pathologist, but the pathologist is still going to have to check all the reports.
Yeah. Do you see a change in the traditional duties from dermatologists being pushed down to primary care as a result of those diagnostic aids?
No, I think no, not at all. I think the hopefully that the specialists in these areas will actually focus more on the high risk lesions rather than the low risk lesions, so they'll be able to make more effective use of their time and actually benefit the patients more rather than less.
Yeah, okay. So it's really great to hear that during this COVID period, you've been able to maintain your activity levels. As a serial entrepreneur, do you spot any opportunities in the market now? Are there lasting changes that you see, positive or negative, coming out of this situation?
Yeah, so I've thought about this a lot actually. I think on the one hand, telemedicine surely has to increase. So I think there are opportunities for telemedicine, for teleconsults, for people not wanting to come in. So I think there are amazing opportunities. I'm not sure which are the companies that will benefit from that. Obviously, Teladoc in the USA has done tremendously well over the last few months, but I do think that telemedicine is a big opportunity around the world. So that's certainly one of the big opportunities that I see.
Good. I told you 15 minutes would go fast, and it certainly has. It sounds like we've identified some of the things that we need to improve. You mentioned access to broadband infrastructure and quality of bandwidth if we're to support a digital health economy. Are there other things that you see, building blocks that we need, either technology or cultural or policy, to keep the progress moving?
I think we need people who can understand there's very few people who can understand the AI, the data, the medicine, and the business together. I think we need to be bringing, when young doctors or medical students ask me what they should do when they have their year elective in whatever year it is, I say to them, don't go and do some research on pig's ears or something. Go and learn programming and artificial intelligence and robotics and things like that. So we need to be training the new scientists, the new doctors, and the new artificial intelligence specialists in these cross discipline areas, so everyone can understand each other. I think that's been one of the biggest barriers to doing anything, is that we're all talking different languages.
That's really pointed, because I think there are two things that they didn't teach me in med school. One was technology and the other was business. And increasingly, the clinical coalface is dominated by these two facets. So that point is well taken.
Yes.
Ian, thank you so much for joining us on Next Phase and giving us your insights about the role of artificial intelligence going forward and some of the opportunities. It's been delightful. I look forward to catching up with you in person once this period is past us.
Thanks, Simon. It's been great. Thank you.
Thank you.